The People's Pharmacy podcast is supported in part by CocoVia. CocoVia cocoflavanols support both cardiovascular health and cognitive function by promoting healthy blood flow, transporting oxygen and nutrients to vital organs and muscles, including your heart and brain.
CocoVia now comes in an even more concentrated formula, with 450 milligrams of cocoflavanols, 5 times more than the leading dark chocolate bar and 15 times more than the leading cocoa powder.
CocoVia has a proprietary process that preserves cocoflavanols at the highest levels, and the product undergoes rigorous testing at every stage, which allows them to guarantee the highest level of cocoflavanols per serving and to provide the purest, highest quality product possible.
People's Pharmacy listeners can now try CocoVia for 25% off by using the code Peoples25 at cocavia.com. That's CocoaVia.com. Doctors once used pen and paper to summarize a patient's visit. Now they use computers. Do patients have access to that record? This is the People's Pharmacy with Terry and Joe Graydon.
Electronic health records, or EHRs, have revolutionized communications between doctors and their patients. If you use a patient portal, you can now see your lab results, request a refill, or make an appointment. You can even ask questions and get answers.
But can you see your actual health records? In many health systems, doctors use open notes that give patients access to detailed information about their visits.
In these trying times, having electronic access can be especially reassuring.
Coming up on the People's Pharmacy, inside information on electronic health records. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. COVID-19 continues to dominate the health news. We know that in this time of uncertainty, you turn to the People's Pharmacy to keep you up to date on important health news and issues.
Rest assured that we're following the coronavirus epidemic closely. You can find the latest news about it on our website or via our email newsletter. When you subscribe to the free newsletter, you also get access to our special health alerts.
We're thinking of all of our listeners during this difficult time, and we wish you and your families the very best of health. We know you're washing your hands carefully, using smart physical distancing practices, and staying home and away from crowds.
And to our health professional listeners working on the front lines, we know the tremendous and heroic sacrifices you're making to keep us all safe. We see it, we appreciate it, and we appreciate everything that you do. Stay well and stay safe. We hope you're getting the personal protective equipment you need.
Because of physical distancing, it may be hard to see your doctor for routine medical consults. Getting a refill on a regular prescription could also be challenging. That's why electronic health records and patient portals are so important at this difficult time. Most hospitals, health systems, and clinics now use electronic health records. Many encourage patients to utilize their electronic access, called a patient portal, to communicate with their healthcare providers. This allows you to ask a question, make an appointment, or request a refill.
The idea behind electronic health records was to involve patients more actively in their care. One particular innovation allows patients to see the notes their doctors keep from clinic visits.
This is called Open Notes. Later in this show, we'll get a doctor's perspective on this channel of communication between physicians and patients. Dr. Danny Sands is founder and co-chair of the Society for Participatory Medicine. He is a primary care doctor and a health information technologist. Dr. Sands is the chief medical officer of Backpack Health. He's on the faculty of Harvard Medical School.
But first, we turn to Dave DeBronkart. He's best known as ePatient Dave. He's a cancer patient and blogger who became an activist for healthcare transformation through participatory medicine in 2009. He's an avid advocate for personal health data rights. His latest book is Super Patients, Patients Who Extend Science when medicine is out of answers.
Welcome back to the People's Pharmacy, Dave deBronkart.
It is a true honor to be back in touch with some of the real pioneers of the e-patient movement. Little did you know back in the last century what you were doing would be world-changing well into this century. So
True
it's a pleasure
enough.
to be back.
Well, you're right, and thank you very much for the compliment. But first, you are known as e-patient Dave. What the heck is an e-patient anyway?
Well, it's funny. When culture change is happening, after a while, people start arguing, and this is a wonderful thing because it means a movement has matured. People start arguing about the fundamentals, which the beautiful thing about that is that it means that the population is taking ownership of the idea instead of just bouncing around. Anyway, originally, back in the 90s, Tom Ferguson, who we all knew and loved. Well, I didn't. He died before I came along. But he noted that an e-patient is to patient as email is to mail, the electronic connected version. And he started noticing what people like you were doing using the internet to alter what's possible in healthcare. It used to be that any connected patient, by definition, was somebody who was empowered, engaged, equipped, enabled. Otherwise, they wouldn't have been on the internet back then. But today, everyone, including all kinds of spineless idiots, are on the internet. So what I like to focus on is that it's a patient who is empowered and engaged, really thinking about their health and their care, rather than just sitting back and saying, well, I don't know, you're the doctor, you tell me what to do.
Well, the internet is a wonderful tool, and it can be used, as you say, in all kinds of ways. So let's talk about some of the ways that it can be used, and in particular about one of the most basic tools that we have available to us online, and that is the patient portal. What's a patient portal, and what can we do with it?
Well, it's funny. A patient portal, in very general terms, a portal can be like in science fiction, it's a door into a different universe. And in a sense, you could say, for me sitting here at home, a patient portal is like a tiny door into one little cupboard in that universe. It lets me see things at my hospital or doctor's office, like my blood test results and scheduling appointments and so on. It is the very first, earliest version 1.0 step toward me being actively involved in everything that's going on in the healthcare system. It is better than nothing, but not by much. It's a first step. And there are arguments, by the way. People in the health system, some of them, are benighted. They think, why would patients even want to look at this? Or they offer just a tiny dribble of information. And then they say, look, patients aren't interested in this. They're not excited. I told you it was all a crock. Well, we can talk about that more later.
Well, Dave, you are e-patient Dave, and people may be wondering, because you have quite an exciting story, how did you become e-patient Dave?
Well, it's funny. So the first, in terms of the name, after I nearly died in 2007, my doctor was another one of Tom Ferguson's friends. And on my previous appearance on your program, we presented together Dr. Danny Sands. He was noticed by Tom because back in the 90s, he co-authored the first medical journal article about how doctors can use email with patients without it ruining the doctor's life. So if any of your listeners have a doctor who says, I'm not doing email with you because it'll ruin my life, ironically, that expert doctor may be 20 years behind the literature, which is something to think about. Anyway, he, at the time of my diagnosis, and you can believe, when I was diagnosed, my median survival was 24 weeks. I was almost dead at the moment when I was diagnosed.
This was a cancer of the kidney, is that correct?
Yes, thank you. That's a whole other long story, but I found out of nowhere, just as a result of lucky shoulder x-ray, there was a shadow near my shoulder in the lung that turned out to be kidney cancer, and that lucky x-ray helped save my life. I had metastases all through my body, and in addition to getting the best care I could find, there was this pivotal moment, and I recall this conversation vividly in Dr. Sand's office, where he said, "Dave, you're an online kind of guy. You might like to join this patient community. They've got good stuff." And he recommended this organization called ACOR. They've now migrated. They've become smartpatients.com. And this was a group founded by Gilles Friedman, who was another friend of Tom Ferguson. So in a sense, my access to this social network of other patients was through the social network of these leading edge thinkers, which include you and Gilles and Tom and so on. Well, what he was doing, what Dr. Sands was doing, was inviting me to be an e-patient, to be engaged, involved, empowered, and so on. It's the precise opposite of telling me to stay off the internet. See, he didn't tell me to stay off the internet. He showed me where to find the good stuff. That's what people should look for, is a doctor who will help them in that way. Long story short, it turns out some of the information that those patients gave me helped save my life, according to my oncologist. There's an article in the British Medical Journal in 2013 about this. They had useful information that doesn't exist in the medical literature. And by September of that same year, 8 months after my diagnosis, I was not dead, I was cured. And it was a few months after that Dr. Sands told me about Tom Ferguson and the e-patient movement. I read the e-patient manifesto, called the e-patient white paper, and I was like, holy crap, how could I have gone through that year without you telling me that I was being an e-patient? And I immediately renamed my blog. My first blog was called The New Life of Patient Dave, and I just renamed it to e-patient Dave, just because I wanted to spread the word.
You're listening to Dave DeBronkart, also known as e-patient Dave. He's a cancer patient and blogger who became an activist for healthcare transformation through participatory medicine in 2009. He's an avid advocate for personal health data rights. His latest book is Super Patients, Patients Who Extend Science When Medicine is Out of Answers.
And Terry, Dr. Tom Ferguson was my best friend, and he was, without doubt, a visionary when it came to the whole concept of participatory medicine. I mean, I don't think initially that's what he called it. It was just...
No, he didn't. I know that for sure.
It was treating patients like
people,
equals. Doctors and patients needed to collaborate as partners in their own health care.
Well, Tom was very interested in self-care and pointed out that the vast majority of the care that we get is what we give ourselves.
And if you'd like to learn more about participatory medicine, you can go to participatorymedicine.org. It will give you a lot of information. We need to take a short break. After the break, why aren't more people accessing their own health information?
We'll be talking about Open Notes. What the heck is that?
Why doesn't everyone have access to Open Notes?
If patients find mistakes in their records, can they correct them?
We'll also find out how you could become an e-patient. And later, we'll talk to Dave DeBronkart's doctor, Dr. Danny Sands.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. KAYA Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's Kaya Biotics.com. Use the discount code PEOPLE for $10 off your first purchase.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by CocoVia, the maker of high-potency cocoflavanol supplements that support cognitive and cardiovascular health. More information at cocovia.com.
Also by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
Today we're talking about electronic health records. Can you access crucial medical information about you? Is it possible to correct mistakes that may be found in your records?
Our guest is Dave DeBronkart, also known as E-Patient Dave. He's a cancer patient and blogger who became an activist for healthcare transformation through participatory medicine in 2009. He's an avid advocate for personal health data rights. His latest book is Super Patients, Patients Who Extend Science When Medicine is Out of Answers.
Well, what you demonstrated personally and now through your blog and through website and through your books is the importance of being involved, being engaged, being informed. And one of the ways that hospitals and healthcare systems have been encouraged to do that is through something called an EHR, an electronic health record. I wonder if you can give us a quick snapshot of what the overarching goal was when the EHR, the electronic health record, was launched, and maybe a little insight into where it is today.
Well, somebody a long time ago, and actually this was first done, believe it or not, back in the 1960s. There was this pioneering doctor named Warner Slack, and there's this great ancient video of a public television program of Warner Slack showing the reporter how you can type information, medical information, into the computer and then look at it later. Well, surprise, surprise, it took a half century for medicine to catch up with this idea. And the whole idea, starting in 2009, everybody said, it's too hard. I don't want to computerize your information, even though all your money information and plane tickets and everything is all in the computer. It's too hard and it'll cost too much. So as part of the 2009 Economic Recovery Act, the U.S. government provided $40 billion with a B dollars to help hospitals buy these computer systems. A great idea. The big problem is that the only medical computers at the time were billing machines. So it's as if you tried to take a cash register in a store and add on a website. So it's been messy. But what we have accomplished so far is these computers are now pretty much installed everywhere. And now that they're hooked up, we got to change how they work so that they're more usable for the doctors and more useful for us.
E-Patient Dave, there was in Health Affairs in November a study published that said only one patient in the U.S. out of every 10 actually accesses the health information, the online health information about them that they have access to. So not everybody has access to this health information, but of those people who do or could have access, most people aren't using it. Why not, do you think?
Well, I'll tell you, I mean, for heaven's sake, people working in healthcare are supposed to be smart. The problem here, and that the real irony, is that I was in Washington for some of the policy wars at the onset of this whole discussion of installing computer systems. There were people who didn't want patients to be able to look at what's in the computer. There are still people who believe that patients don't want to. And that's what ticks me off, to clean up my language a bit, about this stupid article. Because the arguments were, well, we don't want to have to give patients access to lots of useful information. All they should need is their blood test results. And the real problem here is that that's the stuff that was convenient for these whiners who were getting $40 billion of money. $40 billion, and they're whining about having to do something to put data in it. Well, so they put these little crumbs out there. And they say, so look, nobody's interested in this. And instead, I'm going to switch over here, because in life before cancer, I worked in marketing, and in particular in introducing new technologies. This was in the graphic arts in particular. But what you're asking people to do when you introduce new technology is change what they've been doing and start doing something else. And this opens up the whole field of behavioral psychology as a resource for how you change behavior. And there's this guy, B.J. Fogg, F-O-G-G, related to the Fogg Art Museum in San Francisco, who has this great model that says behavior change is a function of motivation. Do I have any reason to do it? Ability, which is how easy is it to do? And do I have a moment come up, a trigger, a prompt when I might want to do it? And essentially, if there's very little useful information in the patient portal, that means your motivation, the M in the equation, is really low. And then they turn around and say, well, patients don't want to do this. I say, give me something meaty, something worth getting my hands on. And then when I have a problem, which is the trigger, the prompt, then I'll have a reason to dive in there. And that's exactly what you find. It is a mistake to give people mediocre information when they don't have a problem and then complain about them not using it.
Well, let's talk a little bit about the electronic health record as it exists for most patients in America. They can, in many cases, get to their, for example, MyChart, just being one example from a company called Epic, and they can see their lab values. They can see how much they owe. They can pay. They may even be able to make an appointment or see when their appointment is coming or which appointments they've made. But they, generally speaking, don't have access to their actual meaty health information. We've written about this on our website, and there are now so many comments from visitors who say, I want to see my health information. I want to see my quote-unquote clinic notes, which is where the doctor actually tells you what you've got, what you're supposed to do, what the possibilities are, where the future lies. And I suspect that you've heard of something called Open Notes. What is that? How well does it work? Do doctors like it? Do patients like it? Give us the straight and skinny on what the electronic health record could be.
Imagine, if you will, dear listener, that you were working with somebody who is your friend and partner. You were their client or vice versa, but you're both working on the same pile of information together. And now imagine that you two get torn apart and you have to work separately, and each of you can only see half of what the other one's working on. Well, so the version where you can work together is Open Notes. I am on the Open Notes advisory board. I'm a passionate believer in it. And so is my doctor, and I were the original guinea pigs in the first clinical trial in 2012 where it was tested. With Open Notes, after every doctor visit, a day later or so, I get an email saying your doctor's note is ready for you to look at. And so I go and look, and I can see that here's one trivial example of how useful and wonderful this is. A couple weeks after a visit during that test back in 2012, at 11 o'clock at night, I thought, oh crap, I was supposed to follow up on something. What was it? Well, in the old world, I would have had to wait until the next business day and try to remember to call in and make somebody stop what they were doing and go look up what I was supposed to do. Either that or I just wouldn't have done it, and I would have gotten a black mark as being non-compliant. Instead, I went online right away at 11 o'clock at night and said, actinic keratosis, this crusty thing on my scalp. And then I went over to the dermatology part of the site and made an appointment. So I was a better patient because I had access to the doctor's visit notes. It is a mystery to me why so many doctors resist this idea, but the tide is turning because there are dozens of scientific papers now establishing, well, even in the original study, consider this, 91% of physicians, when they saw the benefits of open notes, doctors who were in the test, including the skeptics, 91% said they wanted to continue, and 100% of patients said they wanted to continue. A very senior physician said at a conference where I was speaking, in his entire life, he has never seen anything that 91% of doctors and 100% of patients all want to do. It's a good thing.
Which brings up the question, why aren't we doing it everywhere? There's still only a few, fairly large, but nonetheless just a few, healthcare systems that provide open notes to patients.
And what exactly are open notes?
Well, if I'd known you were going to ask, I could just open one up. It is what the patient presents with blah, 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 blah. He comes here today because of a pain in his shoulder. Observations, blood pressure is this, I measured this. Flexibility of the shoulder seems good. And then one of the things you'll find is sometimes, because doctors are human, they actually will say, oops, left shoulder. No, this was the right shoulder. All right. One of the beautiful things that happens, you actually get to see what the doctor put in the computer. And if the doctor makes a mistake, then any future doctor who looks at that is going to come away with the wrong answer. And twice that has caused major problems for my mother, which is one reason I take this personally.
Now, tell us, is it possible for patients to correct mistakes that they find in their records?
Possible. Is it possible? It is legally required, and it is really hard to do. Now, first of all, you've got legally under the HIPAA health insurance, health information port, blah, blah. It requires that if you spot a mistake in your record, they have to fix it. Almost all hospitals don't. They just drag their feet. And a real problem is that although this is a federal civil rights issue, the HIPAA laws administered by the Office for Civil Rights, there are no cops who go out and give hospitals data tickets for having wrong information and not fixing it. Now, even if everybody wanted to, there is not yet software to let me say, like if you've ever worked with a Google Doc or something like that, where you can look at what somebody drafted and you can make a comment, that software just doesn't exist.
Doesn't exist for medical records, even though Google obviously has figured out for lots of other documents.
Yeah, there is no technological reason for it to not exist. They just, as we saw with the installation of computer systems in the first place, they just say, well, I'm not going to do it if you're not going to pay me. And that means that they have other priorities than patient welfare.
They definitely are concerned about the bottom line. But, Dave, I'm having a little trouble understanding the difference between open notes where you implied that you could correct a mistake, and what almost everybody else has as far as their electronic health records are concerned, because we've received so many messages from people who said, my EHR, my electronic health record, says that I had dialysis and that my kidneys were shot. Well, not exactly in those words, but basically, I do not have any kidney problems, and I've never had dialysis, and I can't correct my electronic health record, or it has my medications all wrong, and I've corrected it 4 times, and every time I correct it, it goes back to the way it was before. So obviously, for most people, correcting mistakes in their electronic health record is a real challenge. What about on Open Notes?
I did not mean to imply that with Open Notes or anything else, you can correct mistakes. You can see the mistake and you say, holy crap, my mother does not have diabetes. And you can tell the office to fix it, but I have no ability to fix it. All right. And it turns out, so remember, the first Open Notes study was published in 2012. We are 7 years later. And it turns out there are 2 dirty secrets, and I'm willing to say dirty secrets, about why some hospitals don't want Open Notes to be implemented. One is there are a whole lot of mistakes. A colleague of mine, Peter Elias, who's a retired primary care doctor in Maine, said that he was told repeatedly by his employer that the data in their system was too poor quality to let patients see it. Doesn't that scare you?
So in summing up what people need to do to become e-patients, one of the things that you are renowned for is give me my damn data, and DAM stands for?
Data about me.
And why is that so important?
Well, it's your only chance to find mistakes and ask to get them fixed. And as I said, it applies to family members as well. It's not all evil, Humans type stuff in, and people typing make typos, And then there's also the malarkey stuff. There's another. A great Yale cardiologist named Harlan Krumholtz is a passionate advocate for patients to have access to their information. Partly so, if they're in trouble, they can move to another hospital if they need to. And he recounted, I can send you the link if you want it, he recounted a phone call he had with a health system CEO who said, Harlan, we have a marketing concept called affinity. We don't want patients to leave. Why would we make it easier? Now, there's a CEO saying, I don't care if it's better for the patients. I want their money to stay here. I think that's immoral, personally.
And we agree completely. E-patient Dave deBronkart, thank you so much for talking with us on the People's Pharmacy today.
Can you tell I used to be a hippie radical? I am sociologically impatient. Thank you for the work you guys do. It is a blessing.
And thank you for yours, too. You've been listening to Dave deBronkart, also known as E-patient Dave. He's a cancer patient and a blogger who became an activist for healthcare transformation through participatory medicine. In 2009, he's an avid advocate for personal health data rights. His latest book is Super Patients, Patients Who Extend Science When Medicine is Out of Answers.
After the break, why has it been such a struggle to get patients their data?
We'll talk with Dr. Danny Sands, who was involved in the development of the Open Notes concept.
Initially, doctors were resistant to the concept. How come?
Learn about the utility of Open Notes from the physician's perspective. How could they be improved?
We'll also talk about the next version of Open Notes. It's called Our Notes. You're
listening to The People's Pharmacy with Joe and Terry Graydon. This People's Pharmacy podcast is brought to you in part by Verizana.com.
Verizana Lab offers home health tests that allow you to monitor your hormones and health conditions. You can take control of the quantitative assessment of your health and learn about male and female hormone balance, the stress hormone cortisol, leaky gut, gluten intolerance, or your gut microbiome.
Take a more active role in tracking your health and take 20% off your first order of a mail-in testing opportunity with the discount code PEOPLE. That's PEOPLE, all uppercase. To learn more, go to Verizana.com. That's VERISANA.com.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by CocoVia, offering plant-based nutrients in the form of cocoa flavanols for brain and heart health. Online at cocovia.com.
And by Kaya Biotics, probiotic products made in Germany from certified organic ingredients, KAYA biotics.com.
Today we're talking about EHRs, also known as electronic health records. We've just spoken with ePatient Dave about his experiences trying to get access to his data. Now we're going to talk with his doctor and get the physician's perspective on electronic health records.
Dr. Danny Sands is a primary care doctor and a health information technologist. Dr. Sands is the chief medical officer of Backpack Health. He's on the faculty of Harvard Medical School and is a founder and co-chair of the Society for Participatory Medicine.
Welcome back to the People's Pharmacy, Dr. Danny Sands.
Thank you, Terry. It's really great to be back at the People's Pharmacy and to hear you guys again.
Well, Dr. Sands, we just talked with one of your patients, Dave DeBrockhart, about his experience, and in particular, his relationship to his electronic health record. You know, this movement that he sort of started, give me my damn data. Data, that's all about me. And so I'm curious where you sit on this issue of getting patients their data and why it's been such an uphill struggle.
Yeah, this is a really interesting and important complex question. I've been involved in this space for a very long time. In the year 2000, long time ago now, right? 20 years ago, I was part of the team that put live one of the nation's first patient portals that allowed patients to access their records from at least our network in a seamless way. Now, as you know, over subsequent years, many organizations have now have patient portals, but and I think that's a great thing. I really believe fundamentally that patients, if we want patients to be better partners in their care, as I think we need to do, patients need access to the same data set that we have. Now, if a patient gets all their care in my network, in the Beth Israel Deaconess Network and in Boston, for example, they can log into our portal, they can get their records, and that's great. But when they stray outside of that, then they're having to rely on other institutions with different portals, different logins, different user interfaces to try to get that data. And to get a unified view of their data becomes impossible. What we really need to do is we need to but by the way, let me just make a comment. I talked about interoperability a few minutes ago, but that's exactly the same thing that's hampering our patients. So, before we get back to the patient, talk about me. Talk about the poor doctor, too, who's, taking care of you, perhaps, and you've gone to a number of different practices to get your care, not all of them in our network, and I can't even put together a unified view of your life, your health issues. So I have that struggle, and I'm actually really responsible for your care. Now, patients, therefore, are going to have the exact same struggle they can't put together that unified picture. And at least on the patient side, they may be able to log into these different portals and at least get the pieces. I can't even do that to get information from a practice that's just across town or a hospital that's across the street for that matter. So it's the interoperability thing that's hurting us here. So go back to the patient. So what we need is beyond just the patient can look at their information from the Brigham here and the Beth Israel here and whatever other hospital practice over here. We need the patient to get that unified view across all of them with one access. And it's not just viewing the data, but in order to put it in a rational way or do analyses on it, it's really access to not just a view of the record, but it's actually access to the data. But again, this issue of patients not having access is really just a reflection of the fact that the doctors don't have access to that either. And so we can't do that. But I do believe many patients want to do this, not all patients. And that's sort of an interesting issue too, which is that all patients should have the ability to get engaged and have that information. Not all patients want it. Not all patients log into our patient portal even. So I'll let you go on with your question.
Okay, so my question is about at least a first step towards putting together this comprehensive picture that you've been describing. Some time ago, we wrote about Open Notes, and we did hear from people who said, I use it, I love it. We heard from people who say, I wouldn't know what to do with that information. So we did get responses from both perspectives of patients. Tell us a little bit, if you would please, about Open Notes and what your perspective on it is.
So I do believe that if we look at the information in a medical record, there's a lot of information short of notes. So when we went live with PatientSite 20 years ago, we let patients see their test results of all different kinds, their appointments and their immunizations and their all kinds of their problem list, their medication list, and so on. And that was pretty good. Nobody was really doing that at the time. But it turns out that if even as a healthcare professional, that information has limited value. So it's great. It's a lot better than not having it. But so much of the content of the clinical content is really locked in narrative. It's locked in these notes. And so when Tom Delbanco and his colleagues did the Open Notes project and built a tool so that patients could also see their notes, I thought that was really terrific. Because if patients, again, not all patients, as we were just discussing, but if we want patients to be involved in their care, they need to understand the thought process that goes on. They need to understand not only the thought process, but what's the plan? What should I expect as a patient? What are my problems? How does the doctor view them? And what are we going to do for each one of them? So I think Open Notes is a fantastic thing. I encourage all my patients to both read the Open Notes, but particularly look at the end of the note. And the end of notes in most settings contains the information that we call the impression and plan. It's like reading the conclusion of a book, for example. There's all this other stuff. And then at the end is, what are the list of problems? What are we going to do for each one, both diagnostically and therapeutically? So that's a useful thing for patients because they know then that it's a reminder, this is what we're doing with each of these things. So I think an Open Notes is a terrific thing. And I only wish that all of my patients would read the notes.
Now, Dr. Danny Sands, I have to tell you that there are a lot of your colleagues, health professionals, physicians, specialists, who really have some resistance. Maybe that's the nicest way to put it, to the concept of Open Notes. It's like, wait a minute, I'm going to have to write up a summary of what I'm perceiving with this patient in terms of their diagnosis, in terms of the treatment plan, in terms of my actual thinking process. Holy cow, I could get into trouble if I do that. I don't want to do that. I don't care if they see their labs. That's fine. But my actual clinical notes, my Open Notes, ooh, that's scary. I could get sued. So that's number one. And then number two, what I'd like you to address is the issue of mistakes, because it turns out there are a lot of mistakes in those open notes or in that clinical history that's written up. And when patients try to correct them, like, no, I didn't have that procedure done, but it says I did. How do I fix it? So two issues. One, resistance from colleagues. Number two, correcting mistakes.
Sure. So, yes, I understand that I have many colleagues who don't like the idea of open notes. Although, as you know, and I'm sure you discussed, the surveys of doctors who were kind of hesitant about open notes and weren't so thrilled about it, once it was in use, they didn't really want to turn it off. So people warm up to it. And by the way, we met a lot of resistance at Beth Israel when we went live with Patient Site. There were doctors who were really put off by this because it's a change of culture. You know, specialists would tell stories about how patients who they were accustomed to patients coming in and they were going to discuss the patient's test results with them, for example. And the patients would say, you don't have to tell me the test results. I already read them. Let's talk about what you think about them. And that was off-putting at first, but people got used to that. And I think, you know, it's hard to get rusty old institutions to change, but they've got to, and they need to be put under pressure. The other question you asked, Joe, was about fixing errors. And I think that this era of transparency of medical records has highlighted the fact that we have errors in our records. You know, generally it makes sense for the patient to talk to the healthcare professional who's responsible for that. And in the case of their doctor, that's pretty easy. In the case of a radiologist who the patient doesn't really have a connection to, that's a lot more complicated. But if possible, talk to the physician at a visit, if ideally, and say, you know, I'd love you to put an addendum on that note because what you said was this and what really happened was this.
Dr. Danny Sands, could you please just summarize for us the utility of open notes and how they could be improved?
Well, so the utility of open notes is that patients can be more involved in their health and actually follow through with the plan of care much better because they understand. You know, there's a lot of literature showing that when patients understand the rationale behind things, and of course they're involved in the decision making, they're more likely to follow through. So this is a reminder of what is the rationale, what is the plan. That's number one. Number two, it's also educational. It helps patients really understand what's going on with their own health, which, you know, will help them take better care of themselves. So I think that's the benefits to it, to the healthcare system and to the patient. And what was your second question, Terry, related to that?
Could they be improved?
I experiment a lot in my office doing things in different ways. And I do think that, I think that we could improve the readability of notes. And I don't think this is an open notes issue as much as it's a clinical documentation issue overall. We have notes that are largely incomprehensible. And it's not because of medical terminology. It's because of note bloat. So we have all this stuff that's, you know, with a press of a button can be thrown into a note. And I literally received a fax not too long ago from a doctor who a patient of mine was seeing in Florida. And the doctor, it turned out, wanted to highlight two things. There were two lab test results. And yet I received this document that was 12 pages long. So it's hard for anyone, clinician or patient, to see the trees through the forest. We can't, we miss it. We miss the important things. So yeah, I think we need to improve clinical documentation in general. I also think that from a patient's perspective, and I've always thought this would be a really nice thing to do, I'd like patients to be able to look at their note on the screen, and if they want to see that note presented differently, perhaps in a way that might be easier for them to understand, we should have a tool in the browser that does that. In fact, there was a tool that allowed you to look at a medical document and allowed a patient to click on highlighted terms that were medical terms, and it would translate them for them. And that was a really cool plugin. But we could do better than that, I think. So in other words, if a patient wanted this translated into a different language, it would do that. If a patient wanted to just know what a particular term meant or wanted more information, we should be able to do that in an automated way. Because what we don't want to do, and this is what doctors always worry about, is that we don't want patients calling the office because they don't understand something and they want the doctors to explain it to them, the things that are in the note.
Well, of course, you know what patients are going to do nowadays. They'll see something they don't understand and they'll Google it.
Exactly, which is fine. I think it's an opportunity to learn. They may be alarmed, too, and that's the whole, when we're opening up records, when we let patients see their own records, they're going to be alarmed by some things. And patients who get anxious probably shouldn't be looking at these records. That's not to be paternalistic, but I think the patients need to understand it's going to stress me out looking at my record. I have patients like that, and they just say, I'm not going to look, and that's okay. But I think the other way that, going back to the experimentation, the other way we can improve things is let's write the notes with the patients. So as you may know, the next chapter, the next evolution of Open Notes is Our Notes. So it's involving patients in helping to document their visits. And there are some early experiments going on in that area right now. But the way I use this in my practice, I do this in my practice right now, is that I try to do my notes with the patient right there. And as I'm, recording their story, which I've jotted down notes on paper, I say to the patient, actually, I said, let me see if I got this right. I'm going to now talk to the computer. And I talk to the computer because I use a voice recognition system. And every once in a while I stop and I say, is that right? Did I get that right? Or what did you do next? I forgot. And the patient is therefore part of the authoring process. So I think involving the patients more in their notes is like involving them in decision making. It's something we should be doing. But in order to do that, of course, we have some structural issues. We have to deal with the fact that visits are too short, reimbursements are too low for many of these things. But I think that's how we can really improve things.
Dr. Danny Sands, thank you so much for talking with us on the People's Pharmacy today.
My pleasure.
You've been listening to Dr. Danny Sands, founder and co-chair of the Society for Participatory Medicine. He's a primary care doctor and a health information technologist. Dr. Sands is the chief medical officer of Backpack Health. He's on the faculty of the Harvard Medical School.
We spoke earlier with Dave DeBronkart, also known as ePatient Dave. He was a cancer patient and he's still a blogger who became an activist for healthcare transformation through participatory medicine in 2009. Dave is an avid advocate for personal health data rights. His latest book is Super Patients, Patients Who Extend Science When Medicine is Out of Answers. And both Dr. Sands and his patient Dave were involved in founding the Society for Participatory Medicine, as we were too.
Yes, we were actively involved in creating this organization, and we invite you to become a member. You can find out more about the Society for Participatory Medicine by going to the website, which is participatorymedicine.org. That's all the time we have. Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is brought to you in part by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
And by CocoVia, the maker of high-potency cocoflavanol supplements that support cognitive and cardiovascular health. More information at cocovia.com.
Also by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. KAYABiotics.com.
To buy a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1207. The number 800-732-2334, online at peoplespharmacy.com.
When you visit our site, you can share your thoughts about today's show. Have you used your patient portal? Do you have access to Open Notes? At peoplespharmacy.com, you can sign up for our online newsletter or the free podcast.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.